Hey YouTube, welcome back to my channel. If it's your first time here, hello, I'm the Toy Lady. If you are returning, hey Toy Tribe. So before we get started, if you're not 18, get the phone to your mama, tell your auntie I said like, share, and subscribe. How you grandma doing? So I was doing the video on what Planned Parenthood had to say about sex toys, and in the stuff that I was reading, it was saying that sex toys are used to help with or orgasm disorder. So I didn't realize that not having an orgasm was a disorder, but it is so let's talk about what is orgasm disorder. So orgasm disorder happens when you don't have orgasms, duh, or it takes a long time for you to have an orgasm, or you have orgasms less often than you like, or your orgasms aren't as strong as you would like, and you feel sad or worried about it. Okay, it's one of the most common sexual problems, and it may be more common among transgender people. So what causes orgasm disorder? Having an orgasm involves a lot of things: your hormones, physical health, emotions, experiences, beliefs, lifestyle, and relationships. Problems with any of those things could affect your ability to have an orgasm. That's actually a lot. I never knew this. Okay, so the causes of orgasm disorder can include anxiety or depression, stress, tiredness, problems with blood flow or the nerves in your sexual organs, problems with your partner, issues with your body image, low sex hormone levels, medications like antidepressants, blood pressure medications, and chemotherapy, medical problems like cancer, diabetes, heart problems, MS, or bladder problems, menopause, uh, recent pregnancy, delivery, or breastfeeding, so postpartum, and or sexual abuse or trauma in your past, sexual trauma. Now, are there any orgasm disorder treatments? I would say before I read this to like get a toy, but let's read it together. So they say there are many different ways to treat orgasm disorder. Treatment depends on the cause of the problem. Your doctor or nurse or the staff at your local Planned Parenthood health center, because that's the website we on. Donate to Planned Parenthood so they can help the bitches be able to get abortions again. Okay, it can help you figure out the treatment that may work best for you. So then they'll ask you about your health, any problems that you might be having, typical go to the doctor and don't lie type of shit. Okay, just don't lie to your doctor. Okay, they'll also ask you questions about your sex life. Again, try to be as honest as you can about the problems that you're having, because if you're not being 100% honest with your doctor or whoever the fuck you're talking to about what's going on, that they're not going to be able to 100% help you, because your ass can't even tell the truth. I digress. So doctors and nurses are experts and they've seen and heard it all. So again, don't be expecting the doctor to take care to 100% treat your problem when you gave them 68% of the damn issue. You give them the whole 100. So how you expect them to give you a whole 100? Anyway, your doctor or nurse may also give you a physical exam and have blood drawn and check for any medical issues. I definitely advocate, please go and get your physicals every year. Women, go get your yearly pap smears, your mammograms. Sirs, go get your damn prostate checked out. All right, it's not gonna kill you. It ain't. Okay, so treatment options include Kegel exercises, talking with your partner about your likes or your dislikes. And y'all know I tell you all the time, advocate for yourself when it comes to your needs in your relationship, whether it's sexual, emotional, whatever. Advocate for yourself. Your partner cannot read your mind. How they're not gonna know that it's an issue or that you're struggling with something unless you tell them. So you need to have that open line of communication. So please, again, advocate for yourself, and also tell your partner how important it is for them to advocate for themselves to you, so that y'all both could be in the same book, on the same page, because a lot of people think they be on the same page, but they in different fucking books. Okay, And yeah, okay, exploring porn such as movies, magazines, websites, or other sexual entertainment. That's not for everybody, but if give it a, don't knock it till you trying. Masturbating. Okay, y'all know masturbation is meditation. Using sex toys. Told you. Using lubricants or moisturizers, especially if you're using condoms. Like, I haven't used a condom in a long time, but I never really like use condoms. So uh, it's just like it doesn't feel the same. Okay, another way to help combat it is to reduce your stress and to improve your mood through things like meditation and breathing exercises. Okay, limiting your alcohol intake as well as avoiding smoking and doing drugs. um, Regularly exercise to improve your mood and give you energy. Remember, your body is your temple. Physical therapy for your pelvic floor. So doing get you some Benoit balls or some Kegel trainers. Yes, sis. Okay, talking to a counselor who specializes in sex and relationship problems. And especially if you are somebody who has been diagnosed with depression and you are on antidepressants, I think that you should be talking to your therapist about how those two things, as far as your medication and your current state of mind, affects your sex life. Um, Taking estrogen, like a ring, cream, or a tablet that you put in your vagina, especially if you're going through menopause, because your hormones are all over the fucking place. Um, yes, estrogen can help you. With strengthening your muscles in your vagina. It makes it stronger and stretchier, and it increases the blood flow, therefore increasing the wetness. Okay, or you can get a EROS therapy device. I have no idea what the fuck that is, but it says it's a handheld device for vulvas with a small plastic cup. It improves blood flow to your genitals to help you have orgasms and increase vaginal wetness. So I'm assuming that they're just talking about a clitoral stimulator. So again, I didn't know what this was. If you knew what it was, you know, I know now. And if you think you got this issue, if you think you have an orgasm disorder, and again, an orgasm disorder happens when you don't have orgasms. It takes too long for you to have orgasms. You have orgasms less often than you like, or your orgasms aren't as strong as you would like them to be, and you feel sad or worried about it. And it's one of the most common sexual problems, and it's most common in transgender people. So just, be careful. If you're having issues, go to the doctor. Remember, tell them everything that's going on. If you only tell them 69% of what's going on, they're only going to be able to help you 69%. Okay. So this is it. I just wanted to talk about that because it was on my mind and I really had to learn what it was. I don't think I have any orgasm disorders. Even before I used sex toys, I don't think that I had any sort of type of orgasm disorders. So yeah, that's what that is. Thank you guys for sticking around and listening to little old me. Remember, masturbation is meditation. So go play with yourself.